Okay, Assalamualaikum warahmatullahi wabarakatuh and good afternoon. Hello, I'm Dr. Syahrir from Utilization, welcoming all of you to this webinar entitled Mental Health and Psychological Wellbeing Issues and Challenges During Pandemic and New Normal. For your information, this webinar will be presented by Dr. Fonny Dameaty Hutagalung. She is a senior lecturer from Department of Educational Psychology and Counselling from Faculty of Education, University of Malaya, and her expertise is in psychology. Before we start this webinar, I would like to inform all of you that this webinar is 1 hour session. If you have any questions to our speaker, please post the question on chat in YouTube, and I will read your questions to the speaker at the end of this session. I think Dr. Fonny, are you ready?
Yeah, thank you, Dr. Syahrir.
Okay. So without further ado, I would like to invite Dr. Fonny to give her talk. Dr. Fonny, the floor is yours.
Okay. Thank you so much for Dr. Syahrir Abdullah as a mediator for webinar today. Okay, so thank you so much and Assalamualaikum warahmatullahi ta'ala wabarakatuh and a very good afternoon everyone. Before I start my presentation, I would like to express thank you for my deans, Associate Professor Dr. Zawawi Ismail and also the Deputy Deans, Dr. Suzy Lis, to organize this good webinar actually. Thank you so much. My express thank you for your consideration because this topic is a very important for our condition today. Okay, so I would like to start and present my slide. Okay. And also I would like to say thank you for participant today. You attending this webinar. Okay, so the title is a mental health and psychological well-being issues and challenges during pandemic and new normal. I cited Professor Dr. Roxanne Cohen-Silver as a professor in psychological science and medicines and public health in the University of California. She said, "Fear now is different. This is an invisible trait. We don't know who is infected, and anyone could infect us. This is an ambiguous trait. We don't know how bad it will get. We don't know how long it will last. And this is a global trait. No community is safe. So this situation, because of this situation in our country, in around the world, that's why I would like to explain about what's the issue and also the issue and also the challenges during pandemic. Of course, pandemic gives psychological impact on our communities, our level of stress, and our anxiety. This is an epidemic of mental illness occur in the midst of the COVID-19 pandemic. Pandemic also affect all generation. Nobody wants a COVID-19, but we need to accept this situation. That's why when the psychological impact in our community as a person, as a psychologist, I bring this issue to share with my students and the community. Why very important to understand this topic. Okay, so after that, based on the research from the Hong Kong 2019 severe acute respiratory syndrome outbreak, nearly half of survey residents said the experience with on their mental health. 16 shown sign of PTSD, post-traumatic stress disorder, after 6-month outbreak ended. Remember, before this, when I'm a psychologist, I know what PTSD may be from because of the war. I'm research regarding PTSD because of the war in Aceh, Indonesia. PTSD because of tsunami, yeah, because of anything. But now, from the research also, PTSD can because of COVID-19. Why? Why PTSD? Because of COVID-19. Because coronavirus is slow motion disaster. The potential widespread and persistent mental health fallout. Yeah, persistent mental health fallout. Some people, disproportionately affected, especially our frontliner, medical workers, the sick, those display existing mental illness, anyone facing economic challenges. Yeah, our medical workers. I'm so sorry. I'm very, very. Actually, I'm very sad because of our frontliner is burned out. There now is a very stress because of that. Please help them. Yeah, help them. Stay at home because COVID-19 now very, very dangerous in our community. Okay? And also, pandemic meets the criteria of social trauma, leads to rapid, unexpected, often radical changes. Remember now, yeah, the variant from India. This is unexpected to us. Remember, yeah, before this, when the in Malaysian COVID, we are locked down 1.0. We know just COVID only, but now we must be ready for the another variants. That's why radical changes in diverse areas of social our life, our economy, our politics, and also I am also as an individual everyday life we are changed because of the COVID-19. Yeah. Awareness of danger may activate anxiety based on the primary fear in the face of direct or anticipated life hazard. Yeah? Anticipated life hazard. And social isolation and pandemic consequences for the labor market heighten the existential fear in the face of unknown future. Because so many our our workers, jobless, no work, no money, no food because of their loss lost their job, and then they cannot to give food for their family. Okay, it's a very very critical issue now. Yeah, when this situation when this situation so long situation, then can be many stress, many mental health problem in our community. Okay, so we know, what happened when the pandemic we are locked down, in our country 3.0 lockdown. I remember when the 1.0 lockdown, I'm going to Bandung, Indonesia, because I bring the MOU to to UPI Bandung, and then I need to back 17, Alhamdulillah, because 18 March Malaysian they are doing lockdown, and Alhamdulillah I can back 17. This situation to me is a very to me, I don't know what happened in my country, but I believe I can handle the situation. Okay, this is lockdown, and now 3.0. Okay, so with our situation also, we locked down many times. We are closure of school many times. Open, close, open, close. This situation is making our psychological not stable, and also self isolation. Yeah, now we cannot go anywhere. We cannot go, shopping. We cannot go to meeting. We cannot go to working. We cannot go to UM. Yeah, and also maybe my friend Indonesia, we cannot go to university. This is limiting people also. Yeah, people also public places and the ceremony. Many wedding cancels. Yeah, many. I have many invitation. So sorry, Dr. Fonny, we are cancelled because of COVID, because a lot of it's okay. This situation because of we need to war to COVID-19, and also barriers to ensure physical distancing. This situation happen before the weekend. We never know. Yeah, we never happen because of COVID-19. Okay, all those things, lockdown, closure of schools, self-isolation, everything increase our stress matter. Yeah, increase. I believe that we are stressed. Yeah, we are stressed. But please, how to cope the stress, I will be discussed later. Yeah, we stress, and also how to handle the stress. Yeah, so we are burdened. We are after we stress, we burden of our mental health. Yeah, because of that WHO, yeah, they have data according to which 1/4 to 1/3 of today's, world population experiences mental state that meet formal criteria of psychiatric disorders. Psychiatric disorders. Among who at least 264 million people around the world affected by depression. 2020, the latest statistic. Okay, so 1 in 13 globally suffer from anxiety disorders. Yeah, of course. Mm, I'm also sometimes anxiety because when I'm watching television, how many person now positive COVID-19, how many died. This is make me, affect my feeling, affect my psychological also. Okay, so and also pandemic and well-being effect because of affecting both physical health, yeah, pneumonia, liver, and also renal injury. For the psychological well-being, when I mentioned before, fear of contracting an infectious disease, avoid exposure to others to reduce the risk of being infected. Yeah? This is pandemic and well-being. We need to understand of that. And also, our barriers because of social, economic, yeah, and COVID-19 deleterious effect on their mental well-being, and 71% worry about the potential negative impact of isolation of mental health of American. American also, yeah. What happened in American? We know before this, our uh, our kiblat sometimes, yeah, our knowledge, our research, American, but American also, they are very down, they are very affected because of COVID-19. Okay, and then pandemic also, if we isolation, yeah, physical seclusion are reportedly associated with the increase, another issue, child abuse, domestic violence, intimate partner violence, and suicide. Yeah, why? Because of stress. Dr. Fonny, I'm stressed, because I need to, yeah, assess my children. I have 5 children because I have students, yeah, they are masters, okay, and then I cannot cope your assignment, doctor. So what happened? Can I give me time? It's okay, dear. I hope the small helping for you can helping your mental health. Okay, and then child abuse because of family now during COVID-19 cannot go, yeah, our children, they cannot going out to play, yeah, going out to play. This is normally children must be play, but because of COVID-19, because of lockdown, okay, we cannot going out. And then domestic violence, husband beating wife beating children, the circle like that. Okay, and then also a lot of uh, our research also self-harm, yeah, in the Johor, yeah, from PhD student. They said a lot of students, yeah, primary student, yeah, attempted suicide because of online learning. Okay, I'm so sorry. This is the situation. Yeah. Mental health problem associated with the COVID-19, like I mentioned before, slow motion disaster. This is the fact. Okay. Added anxiety and family clinical roles in outbreak situation. And also, yeah, of this tension, yeah. Remember, I'm explained before, lockdown, isolation, yeah, social distancing, quarantine also. Mm, This is tension, further magnified by fear, being quarantined or having to deal with inadequacies of on the system, yeah, like a now situation, yeah, in hospital, lack of ventilators, quarantine, full, yeah, our center full, our hospital full, more than 80%. This is situation can make it stress and anxiety. Our frontliner, family members, yeah, and also we are as a community. We are also community affected for our mental health. Yeah, this is, yeah, pandemic mental health related the social distancing, yeah, contribute rise in depression, self-harm, harmful alcohol, drug use with further negative psychological consequences. Yes, before this, if you read a lot of journals, yeah, Americans, so many American now are alcoholic, drug use, yeah, because of pandemic, they stay at home, no no do no need do anything, then they are just consumption alcohol more than usually. Yeah, this why infectious disease outbreak associated with stigma and also xenophobia. Yeah, after you get like when your family get the positive also, that the stigma masyarakat, your community, social, oh, this family, positive COVID, oh, careful. And also xenophobia. What the meaning of xenophobia? We are prejudiced for another country. Before this, US, they are prejudiced. Oh, COVID-19 bring from the China country. Oh no. Okay, this is situation now. Xenophobia also prejudice because, oh, this family, they are positive COVID, then please don't too close with them. This is the situation. Okay, and also, yeah, additional stressors such as loss of loved ones, loss of loved ones. Yeah, uh, remember, okay, I said after another stress, then one of the bigger stress is the loss of loved one. Before this, we have mother or father, we have sister, brother, but because of COVID-19, you know, COVID-19 take them, yeah, dead. What happened? The family psychological, of course. This is a very condolence. It's a very deepened condolence, deep, and also PTSD. more and more before COVID-19. Okay, this is also quarantine and physical distancing. Yeah, may contribute, and also the parents. Okay, they cannot come to the quarantine center, uh, and also they cannot to handle, yeah, to handle the family and friends, yeah, admitted in hospital, not being allowed to visit, yeah, their sick loved one, but cannot allow. Hmm. A few days ago, I read newspaper, yeah, one of family member stabbing of staff in hospital because, hospital not being allowed him because of the family positive, and very dangerous when they are um, meet or visit, yeah, their family. Okay, so this is also can affect their mental health. I'm a children like that lah. As a anak, how come I cannot meet my mother, meet my father, visit because they are sick. I love them, but the situation, the moral and psychological, together, blending together. Which one I want to choose? Because of that, the situation, stabbing, because of overwhelming the stress, yeah, overwhelming the stress. Okay, and these strategies which limit normal human interaction, combined with fear of the consequences of infection and social media misinformation, yeah, misinformation increase the levels of chaos, stress, and tension within communities. Yeah? So careful when you choose the social media for your information. Please choose the truth. Yeah? Choose the truth, not the fake news. Okay, because can affect your psychology. Okay, so people, before I explain, yeah, people have lost job, their social world, their health, yeah. Sometimes, the effect of pandemic, maybe me, maybe I have, maybe I lost my social world, maybe a bit my health here. Yeah, and I believe every person, they have effect because of COVID-19. Yeah? Okay, so how many? Remember, yeah, a lot of now government help the workers, yeah, especially from the private workers, they lost jobs. Yeah, that's why some of the situation, yeah, cannot cannot cope because their job loss, job losses, yeah. And also more than 38 million American, yeah, made an unemployment claim. Yeah, they are not working, but Malaysian, for the statistic, 80,000, 80,000 now is jobless. Uh, this situation can affect our mental health and well-being. Yeah, and also SES. So remember, a lot of information from the television, from the research, yeah, ethnicity, gender, social position, educational and wealth status, and standard of living, and rest mental health services utilization. This is very significant, impact people health outcomes. SES. Of course, in our country, B40 family, poor family, they are more significant impact than like us, as a government servant. It's a very different. They are size of impact. Okay, so for the pandemic and frontliners, yeah, the anxiety of working in such pressure environment every day, yeah, every day, the passion, yeah, lack of rest can indirectly increase the probability of occurring COVID-19 from working in health facilities. Yes, because they are tired, no rest. Sometimes, they cannot meet their family, yeah, there must be, jauh dari family, from the keluarga, cannot meet their children because of their frontliner must be services to our country. Okay, and also communication, yeah, information changing rapidly, because of some of the, yeah, different people, different, they are very, apa, uh, but they are very confirmed which information they choose. Yeah, people also have a great need for information from the media. If I most choose is government television, maybe TV3, maybe or Astro TV Astro, to make information related to COVID-19. Yeah, because I want to protect my health. Sometimes tuk tak, because how many today the cases, how many deaths today. This is, information seeking behavior may reduce anxiety, yeah, because uncertainty during a disease outbreak or disaster. Yeah, so please don't don't watch too much time, for seeking information regarding the pandemic. You just can, or you limit time, maybe after 6 yeah 6 p.m. Then you watch the television, how the our AG said about the pandemic. Then you can feel, oh, okay, yeah, but I don't know people outside, when with lockdown, yeah, physical distancing strategy being imposed in most nations, yeah, people have turned to different media sources, yeah, to get news updates on the pandemic. Some of person, they are very, like in Facebook, yeah, Instagram, but please, yeah, choose the good one. Okay, because social media is a tools for information dissemination, which can be leveraged to share strategies for dealing with psychological stress in the society, leading active lifestyles, eating healthy, and maintaining social links via a number of communication platforms should be encouraged. But like I explained before, assessing disinformation sources for prolonged periods of time is very likely to increase anxiety and potential for hysteria, those impacting one's mental well-being. Huh? So careful, my dear. Huh? Okay? This is, a lot of people, yeah, large volume of information. Oh my God, oh, what happened now? What happened, Malaysian? How, so some people, they are, not good lah, yeah, give fake news, and also they are not integrity for the news, yeah. That's why choose the good one. Okay. What about students? I love my students. Yeah, the impact to the students, because of that, this topic also I put today. Yeah, due to recent social changes in education domain, yeah, sharing of educational resources and advance in communication technology, the use of distant education is more and more. Yeah, which changes the communication pattern between teacher and students, yeah, lecturer and students, okay, increase the isolation and independent of student. Everything student doing independence, yeah, and those become an important source of pressure for students. Oh my God, yeah, yeah. Oops. Okay. Why? Because some of a student cannot cope this situation. Okay, COVID-19. Yeah. Mhm. Because student can fear of contagion, frustration and boredom, and inadequate information, lack of private space at home. Yeah, I know. Yeah, not everyone they have a big space. Yeah, at home. Yeah, some of my students, they say they stay in the a small house, or some of them is a small apartment sharing with the 10 family members. This is impact to our students. So please, when we are a lecturer, please, your empathy, your kindness, your understanding is a very, very important, because our student needs this element. Okay, you must be ask them, are you okay, dear? What about your study? What about your assignment? Yeah, you need to ask them, not use just waiting. You're passive. When I'm doing with my student, okay, Dr. Fonny, I cannot send my assignment. Can you give me a bit, masa, a bit time? I said, okay, no problem, dears. I give you time. What time you want? 1 week, 2 weeks? Oh, okay, doctor. So this is healing, actually. Healing because of our student now also very stressed, frustrated. Online learning is not actually, we are not what do you call it, yeah? We are not too ready, actually. Yeah, our student also, they are not ready. I remember when I'm teach for the student in some new students semester 1. Oh my God, I need to lower down my language, because before this they are from the STP high school, and enter to first semester in university. Then I need to lower down my language. Many times I'm explained, then they understand. Oh, Dr. Fonny, what is a social psychology? I don't understand. Okay, then I need to explain many times. It's okay. To me, it's okay, because I know this situation can, they our students, some of our students, they are not ready for this situation. Okay, so what about college students in pandemic? Yeah, online learning also still leave college students with the same academic burden as usually. Yeah, and also their anxiety after leaving schools. Yeah? And also some of the result not satisfied. Yeah, not satisfied. Sometimes, they are tertidur, sleeping, because they're very tired. 3 hours, 3 hours or many hours in front of computer. Yeah, this is a situation. Okay. And then another one data, yeah, I got from the Ramli et al. 2018, yeah. Majority of Malaysian students suffer from the excessive stress. The current generation students is much more stressed and anxious than previous generation. Huh? And also compared with the other students groups, primary school students and middle school students, yeah, more stress, yeah, more stress than the university students. This is the situation. Okay, unknown disease cannot be totally controlled, yeah, and also often considered more threatening than factual evidence. Yeah? Feeling of fear, apprehension about having or contracting COVID-19 may be significant stressor for college students. Disease, academic expectation, and attachment are closely associated with student health. Yeah, 2 days ago, my student SMS me, Dr. Fonny, now I'm in his hospital. I'm sick. I cannot do your assessment 3. Can you give me time? Of course, dear. Because our student, dia sakit, disease, yeah. I'm not sure what the disease, but to me, give them, time, yeah, to finish the assignment, yeah, because many situation, many stressing, many we are overwhelming every situation because of COVID-19. Huh? Dulu sehat. Before this, we are good. But because of every change from our community, SOP, yeah, from the government, from the university, yeah, they can affect our stamina, yeah, our psychological. Okay. Okay, online class I already mentioned before. Then the last one is how to cope this COVID-19. All right. So, as a psychologist, after we discuss problem, then we suggest the coping strategy to help our community, our student, our friend, etc., etc. Yeah. So after that, some of the my suggestion, yeah, is you need support. Yeah, you need support from your friends. Yeah, okay. You need support from your friends. Please call your friend every day. You must be talk, chat with your friend. Yeah? Spread love and positivity. Sometimes I'm so sorry lah. Yeah? I open. Yeah? When I'm stressed, I call Dr. Chu. Hi, Dr. Chu. How are you? I love it, and I'm healing my stress. I am happy. After that, I can continue my working. Yeah? I believe if you chat your friend, you can, sometimes all those things just in your mind, full in your mind, but stop in your mouth. Before this, we are going to work. Yeah, we lunch together. Maybe my friend, Dr. Umi, Dr. Susie. Okay, we going to get the lunch, but now we cannot. But to healing your stress, you release your stress, then you can call your best friend. Maybe just 5 minutes, 20 minutes, yeah. Hi, and then bye. This is a positive action actually, yeah. And also, yeah, maybe you can take care of a plant. I have hobby. My hobby now is, tanam pokok, take care of plant. Every day, I siram the plant and I talk to them. Hi, pokok, how are you today? Are you are you okay? Some of the situations sometimes they are, layu, and then I cepat-cepat give the water. Oh dear, no, please, jangan layu. I said like that every day. Every day, I tanam pokok, small plant lah, flowers, yeah. And then this is the situation to healing our stress lah, yeah. Because not every day we can meet people. We just meet our husband, we meet our children, but we need to another. Then pokok lah. And also exercise, oh yeah, exercise is very good for your mind, for your physical. Okay, maybe you just stretching, yeah? Maybe you just dancing. Okay, and also maybe you can singing, yeah. Menggoyang-goyangkan tubuh, your body, yeah. You shake your body. This is the good for the managing COVID stress, actually. Yeah. And then please limit your news consumption, yeah, in your phone. Don't too much. Don't too much, yeah. To use your Facebook, yeah, your Instagram, yeah. This is the situation. Yeah, I thought on the best thing for the COVID-19, we can working together to fight, yeah, to memberantas COVID-19 together with the government, with our family. This is a very important. Sometimes, Mama, you after you going out, please, you shower your hand, yeah. Then this is, the situation. And also you can cooking. You can cooking together. 2 days ago I tried to making bakso, but I'm so sorry, cannot make. Tak menjadi, but it's okay. We try and try, yeah, because cooking together with your family is the happy family must be, to doing activity together. Cooking is very good. Mungkin kalau tanam pokok saya seorang siram-siram, but maybe for the cooking, my daughter, they are very good for the baking. My husband, they are very good for cooking. Cooking, Malay cooking, But I'm also together with my husband, we doing activity. Maybe we cooking another recipe, yeah. Maybe Western food, something like that. This is the situation, or this is the coping strategy. You can do it. I believe that you can do it. Yeah. So last not least, yeah, the key takeaway, I can explain, the world as we know it has changed in many ways for the better. How do we sustain the agility? Ask yourself. Ask critical questions about who and how employees can safely return to a place using new paradigms also. And this one for the organization. Yeah? Maybe our faculty, our dean. Yeah? Don't only address employee acute well-being needs. Use this opportunity to build a culture of well-being. Yeah? And also the last one, leaders are being tested like never before. What you do, yeah, in a crisis will be remembered. Yeah, we can ingat for this situation, maybe after the COVID-19 dah berlalu, insyaAllah Oh, we can remember. Oh, my dean doing like this, yeah. Mengaji, you know, this is a very positive, yeah. And also doing, you know, support, yeah. Yeah, support from the maybe for the WhatsApp group, you know, it's a very good, the very good strategy to help our mental health, yeah, our employee. Thank you so much for your attention. Thank you. And also, I hope this sharing maybe yeah can give you awareness and also the a bit knowledge lah about the psychological yeah aspect issue and challenges regarding mental health issue. Thank you so much. I finished and then I give back this webinar to moderator. Thank you. I stop the sharing. Thank you so much. Assalamualaikum. Dr. Syahrir.
Thank you very much, Dr. Fonny. Thank you all for your attention, your
Dr.
kind attention.
Syahrir.
Yeah. Okay. Thank you very much, Dr. Fonny. Sorry. Thank you very much, Dr. Fonny.
You're welcome.
Thank you very much. Okay, we actually reached the end of the session. So a lot of feedback from I can see a lot of feedback from the YouTube chat. Some of them say yoga is helping. Um, and then do taxes or something like that. And then I can see some of them. I think all some of them can manage the stress during this pandemic session. Okay, Dr. Fonny, I have one question from you. How we manage to avoid burnout during this pandemic session? Like you say, during this pandemic, we cannot go outside, talk with a friend, especially for the person who are single, live alone in the house, in the home. So how to manage burnout and stress during this pandemic session?
Okay, thank you, Dr. Syahrir. Yeah, very good questions. Yeah, maybe my suggestion is, Dr. Syahrir, you have a best friend? I ask you first. You have best friend?
Yes, yeah, I have.
Maybe you have girlfriend, you have best friend, then call them. Call them, yeah, because we need to talk we are social, human social, yeah, manusia yang bersosial. We need person, yeah, we need person to bercakap, talk together every day sebenarnya. Tak boleh simpan ni dalam kepala ni seorang-seorang. So, my suggestion, doctor, you can call and chit-chat lah. How are you? Just ringan-ringan, How are you? And then you makan apa dan sebagainya for the first. And then, another one, you can call your mother. Maybe your mother miss you, okay? Miss you. And also, if you like cooking, yeah, you hobby cooking, you can cooking. Simple cooking, yeah. This is a good activity actually, yeah. Or like I mentioned before, you can tanam pokok, in your house, small plant, and then you groom dia sampai dia jadi satu pokok yang tumbuh dengan baik. It is a very good your punya psychological. Because I believe many lecturer now is a very stressed, yeah, because of COVID-19. Because our our routine before this, we are going to office, yeah, we are going to office. Yeah? We have many friends, yeah? But because of COVID, we cannot. We lock down pula. Then as a so as a individual, you need to coping strategies yang membolehkan you boleh bertahan because of your stress tadi. Yes, I believe I have experienced my friends, yeah, because of COVID. Now they're very psychosomatic. You know psychosomatic, Dr. Syahrir? You know, bila when they are got the news from the TV, the higher cases, yeah, then the itchy in the skin, gatal-gatal, you know. And then I very apa worry about that. After that, they got to go to hospital and meet the doctor. Doctor said, "Oh, you just psychology problem because you are stressed. You are stressed. That's why sometimes she call me, hi, Fonny, how are you? I just, just make she happy, and then, just chit chat. After that, they are healing, they are okay, because we transfer the empathy, we transfer the loving, yeah, we transfer the loving to another person, our friends. Yeah, this is a very good. Uh, I believe now the good person is the not because of their have a lot of money, but the person, they are very kindness, they are very empathy person, they are very apa a good aura positive, yeah, to others. COVID give me learning something actually. My passion to others, my passion to my students, understanding them. That's why, Dr. Syahrir, I think you can do, call your friend and then you
Not me,
cooking.
not me. This question is
Uh,
from
no,
not from me.
from the
I don't know.
participant.
Yes, right, yes, yes.
Okay. That's all to me. Thank you.
How about burnout? One participant asked how to cope with burnout. Like sometimes when we work from home, actually, some of the maybe some of the employees don't keep asking to work, day and night. So then the employer feels stressed, it feels burnt out because so many works during this pandemic at home. So how to cope with it?
Good, yeah. Burn out, yes. Burn out, actually we are cannot apa ni finishing, ya, secara cepat for the burn out. But we can reduce the stress. Before that, I explain. Maybe you can leave it your work first, and then you doing what you like. Like we have a lot of even though we are at home, we can watch apa ni, what do you call TV ni? Television yang ada movie-movie ni, yang streaming ni. Maybe you can watch.
Netflix.
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 Yes, thank you, Dr. Syahrir. Because I sangat jarang tengok Netflix ni. That's why I sangat tak begitu ni, ya. But you can watch the Netflix, you can choose what movie what you want, yeah, what you like, okay? And then you can, you can relax. After that, you can relax, and then you can drink what you want sambil sambil you relax and watch the movie. I believe your burnout can slowly reduce. Don't push. If you burn out, don't push. You still need work yang you buat tugasan tu. No need. You leave it. Yeah? This is very important. What for? we do we finish but not good the result. Yeah, it's better you just relax. You doing what you want. Maybe to me, I have the hobbies after I shopping, and then I need to put in the cabinet. I love it. This situation healing my stress actually. I put in the fridge, I put in the cabinet, and then oh, look nice, and I'm happy. Yeah, that's my burnout can reduce. I don't want to give up because of COVID-19, because of lockdown. I have I have to manage my time like that. Okay.
Okay, thank you, Dr. Fonny. I think one last question before we end this session from Uze Muhammad. Okay, the question is, do you think the PTSD is due to difference of importance of views on the needs of individual or family vs society? Or how do you think the government should manage it on the society level?
No, very good, yeah, and then very high. Uh, berat pertanyaan dia, ya. Okay, good, yeah. Yes, PTSD. Yeah, this is a psychiatric situation, yeah, PTSD because of pandemic. Then government, I believe our government is a very good, yeah, catcher the situation, yeah. When the person assess, yeah, you go to hospital, and then the psychiatric or psychologist, yeah, clinical psychologist assess you have PTSD because of COVID-19. Then I believe they have therapeutic, therapy, yeah, to to apa ni, um, reduce your trauma. You reduce your trauma. But I believe not easy. But boleh. Yeah, you can go to psychiatric, and then you can discuss what's the therapy, maybe medicine punya ubat. You can take the medicine, and also routine. You come to your secretary, and also you can you can maybe the counseling also we can do for the PTSD. Yeah, so that's why it's a very important. Our community education also, yeah, our psychologist, our counselor, we work together, help our community, yeah, open, free of charge, to help person, yeah, because of jobless, because of loss of the loved one, ya, family, ya, meninggal dan sebagainya. It's not easy. I believe I'm also very very upset sometimes. Oh my God, I cannot do anything can help our community because of lockdown dan sebagainya. But after this, maybe we can do something for our community, help them. Yeah, because this is, yeah, our contribution for our community, our students. Yeah, don't blame them, don't labeling them because of PTSD. Apa ni? Sometimes they can affect, yeah, can affect their image. Yeah, they can affect their appearance. Yeah? I remember we have one of students. They are very stressed because of apa ni? It's not COVID lah, ya, because of others issue, ya, PhD until now. Oh, because of loss of mother. Kalau saya ingat, because of loss of mother, they are very stressed until now. I'm so sorry, Dr. Fonny. I cannot write anything in chapter 1. But I need to support her because this situation, yeah, overwhelming. Yeah, overwhelming. Not, I cannot, apa? I don't want to blame her because lost the mother, it's not easy to accept the situation. I believe she also PTSD because of loss of mother, loss of her mother, lost her mother. Okay, Dr. Syahrir, thank you so much.
Okay, thank you, Dr. Fonny, for very good sharing, very good
Thank you.
talk. Okay, I think it is time for us to end this session. Thank you, all the YouTube viewers. Thank you very much for spend your time to listen to join this webinar. Any question you can reach Dr. Fonny. You can check Dr. Fonny's email address in our education webpage, and you also can subscribe to our YouTube channel. We will have more webinar, more webinars regarding this situation in our YouTube channel. So thank you very much all, and please subscribe to our YouTube channel and join us
Thank
again.
you.
Thank you.
Thank
Bye.
you. Bye bye. Thank you.